Hi, it's Doug Holland LMT with another massage tip for massage professionals. Today I'd like to give you a tip on how I make an assessment of where pain is truly coming from when it comes to the elbow. Now, individuals can confuse tennis elbow, which is lateral epicondylitis, with radial tunnel syndrome. Why? Because the pain originates very close to the same area. So how can we quickly make this discernment? Well, what I'm going to do is I'm going to take you down to the table and I'm going to demonstrate how I pinpoint and find the origination of this problem so that we can help our patient. Okay, so a quick way to determine the difference between radial tunnel syndrome and tennis elbow is this. What I do is I get the patient to extend their arm like this. I hold the wrist in this position. And then, as we know, the lateral epicondylitis, which is tennis elbow, the extensors start right about there on the humerus, right? So they're right there on the lateral epicondyle of the humerus, and they go underneath, they extend underneath the arm here on the posterior aspect. So how do you determine the difference between where the muscle belly of the brachioradialis is versus these extensors? I got a really cool trick. Just tell them to pump their wrist. So Lori, go ahead and pump your wrist by squeezing her hand in and out. Can you see this line of demarcation? Every time she squeezes, the brachioradialis rises to the surface. And what you do is you follow that line, keep having them keep pump. You follow that line back and you touch there. Now I'm on the lateral epicondyle of the humerus because I know I'm not on the brachioradialis right now. And so you palpate in there. If there's sensitivity in that area where the tendons originate, where the origination is, then they have tennis elbow. That's how you make your assessment. That's tennis elbow. But most of the time you'll find out, no, it's actually a little higher up into the belly of the muscle. So I follow that line. I go a little anterior to that line right there. And then I press in and voila, now I have it. Now she stopped moving because she's feeling pain. So that's how you can tell the difference between where the pain is originating. A lot of people mistake radial tunnel syndrome with tennis elbow. And radial tunnel syndrome is going to be coming more from a flexion of the forearm, right? We discussed that in the other video on radial tunnel syndrome. It's a flexion, supination, and pronation of the radius. So today people that use the mouse all the time at a computer, those type of things, texting a lot, that's going to create issues in here. Accountants get it, from working the numbers. And so they think they have tennis elbow, but in reality they have radial tunnel syndrome. So that's my little tip on how to find it. Pin the wrist so that it's in this position here. Have them pump their hand, which causes, and you can actually see my arm doing it, right? You can see that line going back and forth even in my own arm. Find that line, follow it through, go underneath to the humerus. You'll find where the extensors actually start. I hope you enjoyed that tip to help you identify the difference of what you're looking at so you can help your patient the best. Well, I hope you enjoyed this tip on how to find that problem on the elbow and make your patients much, much happier. And just remember this, if there's no discomfort on the table, well, then it's nothing more than a foo-foo massage.